Daddy duty. But when we're talking intercartilaginous ossification here, calcification with vitamin D, okay, and this is about the 5th week, all right. Blood supply brings osteoblasts that attach to the diaphysis. And diaphysis is here. We'll get more into the long bone here, but the diaphysis is the mid portion. The ends there, we've got the epiphysis, okay? And in between the diaphysis and the epiphysis there, we have what's called the metaphysis. This is where the red bone marrow, this is where the bone is growing, okay? So the blood supply brings osteoblasts that attach to the diaphysis, okay, which forms the epiphysis, then to the epiphysis, okay, which forms the epiphyseal line. You'll see it in there, okay, and this is where the metaphysis, this is where it all happens right here, okay, all future bone growth occurs there, all right. When we're talking about intramembranous, though, okay, you see the issue is here with flat bones, they don't have that Haversian system. That's not how these bones grow, because their job is not about weight bearing, okay? Their job is more about protection, and they grow differently. So, and when the baby's born, just like what we were talking about there, baby's bones are not solid. And the head is, massive. Baby's head is 1/3 of its entire length, while an adult's head is 1/8. And you'll see there that these bones, they have to be soft or they're not going to fit through the cervix. They're just not. They've got to squeeze through, so there's got to be a lot more give, all right? And that's these bones here are absolutely soft. And there's even holes in our head. We've heard of baby's soft spot, okay? It's called the anterior fontanelle. And it's a hole in baby's head right through to the brain. And it's there and it's open. And what intramembranous ossification, here we're talking about the bone, it kind of grows like it creeps and crawls, and eventually what happens here, this bone here is separate from this bone, but over time what happens here is they start to creep on each other and they form a solid joint, and this will be called a suture. Okay, there's sutures all over the head there when these begin to ossify and harden. Okay, eventually the anterior fontanelle here, these fontanelles, they get plugged up. Okay, and they ossify completely. All right. So intramembranous ossification occurs primarily in the fat bones, the flat bones of the skull, because there's no Haversian system. Skull and mandible of fetus are first membrane before they become bone. Blood supply again brings osteoblasts, okay, which attach to these membranes, ossifying from the center of them outwards. The edge of the skull bones are not completely ossify, allowing the molding of the skull, which comes later, okay? And there's your fontanelles. Very good. Some basic skeletal terminology. And you'll see there's lots going on here. We've got these irregular bones. All right, and there's lots of things going on here. Bones are not just these white, perfectly flat, square-shaped objects. Okay, oh man, there's a lot of walking around upstairs. My goodness, should have done this there at midnight. But anyway, you'll see that there's a lot going on here. You see all these little ridges and grooves and angles and facets. Okay. It's all for muscle attachment, ligament attachment, ribs coming in, and touching and articulations. There's lots going on here. Are we going to go too crazy on this? No. Just to let you know there, my archaeology degree there, for my final exam, my professor there put one of the 206 bones in a bag, and we had to not look at it, just feel it. So no, we're not going to do that. But some words here you may want to investigate further. Sutures, okay, these are these immovable joints that form there when we're talking flat bones, okay, of the skull. There's a fossa, which is depression in or on the bone, okay. Foramen, this is a good one there. This is a hole that goes right through the bone, a predetermined billions of years of evolution hole that allows for blood vessels and nerves to pass through. The biggest foramen in the body is located there in the pelvis. It's called the obturator foramen. Another foramen there you'll see is underneath the foramen magnum, which is at the base of the skull, which allows the vertebral column, the spinal cord, to come in and merge with the brain. We'll get there. Canal, large passageway through the bones. Sinus, we'll deal with these ones here when we go into the bones of the head. If the head was just 100% solid meat and bone, we'd all be walking around with broken necks. All right, because there's no way our little cervical vertebrae would be able to hold such a massive, heavy head. But thank goodness our head, sadly, if you, in a good way, there's lots of holes. There's lots of space in our head there that allow our bones, our vertebral column there to maintain a steady head upright. Articulation is just another word for a joint. Okay, bone A comes together to meet bone B at an articulation. Okay, they articulate together. Facets, these are these little spaces there where a bone is supposed to meet. Okay, and you'll see there that this facet here fits there with these facets. Okay, and that's how the spinal column there keeps the ribs all in check. We've seen this there before. These are just the different classifications of bones. Now we're going to move on. Long bones. Regions of the long bone. There's your diaphysis. Okay, that is the area there, the long bone. Okay, in the middle. Your epiphysis. There are two. All right, at either end. All right. And your metaphysis, we've spoken about, is in here. Okay, this is where the bones are growing. Okay, and inside there, your medullary cavity. Tissues of the long bone. Okay, we have cartilage. Okay, you're going to see there articulating cartilage there around the edges of the bone because we do not want bone touching bone. Okay, there's your articulating cartilage. There is your endosteum, which is on the inside of the medullary cavity. Okay, you have your periosteum, which is on the outside. Okay, and this is where the osteocytes are. Okay, there's blood flow in here, and they're allowed to they communicate there between the osteoblasts and clasts. Okay, so cartilage, periosteum, endosteum, articulating cartilage. So this is a little bit of information there about the long bones. We're going to go into each of these in a little bit more detail. So you'll see there your diaphysis, main shaft of the long bone, hollow cylindrical shape, thick, compact bone. And you can zoom in. I apologize, I don't know, these slides there not so good, but you can zoom in if you need to, okay? You can stop and pause this. You guys have your own copy of the PowerPoint. Strong support without cumbersome weight. And you'll notice there that hollow is actually stronger than solid. Funny enough. And it all has to do with the dome shaped, okay, that curve shaped within the inside of the bone there, okay. Your epiphysis there, both ends, okay, and this is your tibia, okay, you have a look here, and both ends of the long bone made of cancellous bone filled with marrow. You'll see there this kind of a bulbous shape, okay, and different shapes and sizes on the each of the epiphysis there, because it all has to do with muscle attachment, ligament attachment, these kinds of things, okay. Metaphysis, right in here. We've kind of alluded to this already, but we'll go into a little bit more detail here. Each epiphysis meets the diaphysis at the metaphysis. Again, each epiphysis meets the diaphysis at the metaphysis. And you'll see there that there's another one there. And I'll just... right there. Okay. During growth, the metaphysis contains the epiphyseal plate, the site of long bone elongation. When the bone stops growing in early adulthood, the epiphyseal plate becomes an epiphyseal line. So if you see so when the individual stops growing, the epiphyseal plate turns into the epiphyseal line. Okay? Interesting enough. Articulating cartilage, layer of hyaline cartilage. Take note of that because later on in the PowerPoint there are 3 kinds of cartilage there that I'm going to be requiring a little bit of knowledge of what it looks like and where you can find it. Articulating cartilage is hyaline cartilage, and you'll see there later on that I have some electron micrographs there that I'll show you. Okay. This articulating cartilage there covers the articulating surface. Okay, articulating surface. What are we talking about? The joint surface. Okay, the epiphysis, and cushioning jolts and blows. Okay, good. The periosteum. This is the outer covering there of the bone. Dense white fibrous membrane that covers the bone, contains osteoblasts and clasts, contains blood vessels there that send branches into bone, important for growth and repair. So the blood is here and it goes inside. So you'll see there that there's holes throughout the bone there that allow the blood vessels there to get inside, because that's where the marrow is. That's where the blood is being made. The periosteum there attaches tendons firmly to the bone. Okay, so a very, very important outer covering. The medullary cavity, that's on the inside here. Tube-like hollow space in the diaphysis of the long bone. Also contains the marrow cavity, contains blood vessels inside of the... And in this case here, you see there, the blood vessels there from the outside of the periosteum going inside where? To the medullary cavity, the inside receiver of vessels there from the periosteum. Important for growth and repair, of course. In adults, it's filled with connective tissue rich in fat, yellow marrow. So in younger individuals there that are still growing, the red bone marrow there, it's active, but as we get older and stop growing there, that some of that marrow goes yellow, gets fatty and inactive. But funny enough, that yellow marrow in times of stress can be converted back into red marrow. We'll talk more about that. Endosteum there, here we're talking the inside lining as opposed to the periosteum. The endosteum is the inside lining of the marrow cavity. Okay, thin fibrous membrane that lines the medullary cavity. Okay, good, good, good. Moving into the bone marrow. You'll see there that I have these slides, a whole bunch of them there. We're talking about the marrow. It's interesting stuff, and you'll see here that this is a photograph of the head of the femur that's been removed during a hip replacement surgery. They've just whacked the whole top of the femur off, and that's what you're looking at. And just going through, there's your articulating cartilage. Okay, and as we all know, there's your compact bone. These are all osteons on the outside. Okay, and here you've got your trabeculae. Okay, and your red marrow. And you can tell that this is an older individual there because we have yellow marrow on the inside. And a hip replacement, you wouldn't be doing that generally on a 12-year-old. Okay, older individual like myself. A wedge has been removed from the bone to show the marrow spaces. 2 types of bone marrow. We'll talk about these, red and yellow. Red bone marrow, okay, has myeloid tissue. Why? Okay, this is involved in RBC production. It's found in the medullary cavity of long bones and in the spaces there of the spongy bone. RBC production found in virtually all bones in an infant's or child's body. Interesting. Red bone marrow found in all bones of infants and child's body. Main bones in an adult there that still contain red marrow include the ribs, bodies of the vertebrae, humerus, pelvis, and femur. Interesting enough. So all children's bones contain red marrow, but as we get older, the red marrow is confined to these spaces. Okay? Interesting info. Yellow bone marrow. Okay, these are marrow cells that become saturated with fat and are no longer active in RBC production, replaces red marrow as a person ages, can change to red marrow back in times of stress, anemia, exposure to radiation, and certain diseases. Okay. Bone marrow transplant. These are quite common there these days. Okay. If the bone marrow is severely damaged, the bone marrow transplant could be life-saving treatment. If the recipient's immune system does not reject the new tissue, the donor cells may establish a colony of new healthy tissue within the bone marrow. Okay, it's all about the recipient's immune system. We don't want that to be rejected there by the recipient. So Good stuff. Factors that can affect bone growth. These ones here, I'm not too worried about these ones here too. You guys are pretty on top of that. We're going to get into hormones there. I'll introduce a little bit there today, and we'll hit these hard there in the weeks to come. But diet, of course, you are what you eat. Okay, adequate minerals, calcium, phosphorus, magnesium. Okay, exercise. Remember those the osteocytes? They're involved in stress sensing. Okay, and if you're not jumping around and walking on your bones, well, your body's going to go, why am I putting so much effort into maintaining a healthy bone when these bones aren't getting used? They'll start to make the bones weaker. Wait until we get into osteoporosis as well. So please make sure that you get a little bit of exercise there every day for your muscles as well as your bone density to maintain proper bone density. And a little bit of a fun fact there, we are at our maximum bone density within our 30s. Okay, so our bones are healthy, strong, they're tough up until and into our 30s, but then after that, the bone density starts to decrease. Okay, that's where bones get weaker. Proper hormone function, endocrine system here. Here we're talking about growth hormone, which increases tissue formation by acting directly and indirectly on target cells. We have IGFs, which are insulin-like growth factors. Okay, critical mediator of bone growth. Thyroid hormone, we'll get there next page. That's your calcitonin and your parathyroid hormone. Insulin, okay. The whole idea there of sugar in the blood, getting rid of it there, that impacts activity, okay, which then directly will affect bone growth as well. Sex hormones, they stimulate the osteoblast bone growth for sure, okay. The thyroid hormones, calcium homeostasis process. The body uses hormones there to regulate and maintain homeostasis of the bones, such hormones include these two here. This is a 5-star. I love these two. Okay, there's the parathyroid hormone. Okay, when blood calcium is low, parathyroid hormone stimulates osteoclasts to break down bone to release calcium back into the bloodstream. Calcitonin. When blood calcium is high, calcitonin prevents osteoclasts from breaking down bone, allowing calcium there to go back onto the bone. Here's a nice little diagram. Again, we'll get more into this there. Okay, there's your thyroid. Okay, and this is a posterior. We're looking at the back side. Okay, the person's neck is right here, and we're looking at the back of their head. Okay, the spinal column is right here. Okay, and this wraps around kind of the front of the throat, and on the back there, there's 4 little, they're about the size of peas. Okay, these are your parathyroid. Okay, these ones here, they only produce parathyroid hormone, and the thyroid itself, it produces calcitonin. So the thyroid there, when there's high blood calcium level, produces calcitonin, which then gets that calcium back on the bones, decreasing the calcium level in the blood. But when the calcium level is too low in the blood, the parathyroid produces parathyroid hormone, okay, which then robs the bone, starts to break down the calcium from the bone and get it back into the blood. Okay, homeostasis, gotta like it. Getting more into the anatomy here, there's your axial skeleton. I love them all. Love them all. Okay, axial skeleton, this is what we're dealing with here in blue, as opposed to the backside here. Okay, let's have a look, shall we? Cranium, num, num, num. Okay, 2, 4, 6, 8. Okay, there's the frontal bone, occipital bone, sphenoid bone. Okay, you can't really see it from in there. There's your ethmoid bone. I have better shots that I'll show you there. It's on the inside. Your parietal bones. Okay, you got one on this side and you got one on the other. Temporal bones. Again, you'll have one on this side and another one there on the other side. Okay, so these there are the bones of the face, or these are bones of the skull. Okay, please don't forget about sutures. And as a child there, you'll see that these bones are separate, but as we get older there, they ossify. Intramembranous ossification produces these sutures. And you'll see them. There's a couple slides there. Actually, the very next one. You see all these different sutures there between the bones. Okay, there's your lambdoid suture. Okay, sagittal suture there down the middle. Okay, your coronal suture separates the frontal from the parietal. Squamous suture there, the parietal there from the temporal. Okay, good stuff. Have some fun with it. Just a posterior view of the skull. There's that sagittal suture down the middle, parietal, right parietal, left parietal. Okay, your lambdoid suture separates the two parietals there from the occipital bone. Okay, there's your temporal bones on the side. All right. The sphenoid and ethmoid, these are weird ones, okay? And I'm not going to go too crazy into them, but they fit inside. And interesting, aren't they beautiful to look at? Very strange, okay? I'm not going to go into too much detail here. I'm not going into any of the hypophyseal fossa, the sella turstica. I'm not going, just the sphenoid bone. Have a look at it. Interesting. There's your ethmoid bone, and you'll see where that one sits, right in the middle there. That's a beautiful looking one as well. Okay, I'm not going to go into, I'm not going to ask you for the Christe Galli. I'm not going to ask you any of these here. Just interesting there to see. Foramen magnum, alluded to earlier. This is at the base of the skull there, and you'll see that there's a predetermined hole. This allows the spinal cord to come right up, okay, and join ranks there with the brain. Okay, that's a beauty. Love it. Remember our fontanelles? Good. Axial skeleton, vertebral column. Okay, we're still dealing with axial, and you'll see there that there's 5 main parts to the vertebral column. You'll see that there's 7 cervical vertebrae, and we label those C1 to C7. Okay, cervical, and there's 7 vertebrae. Moving on to the thoracic, here we're into the chest portion. There's 12 thoracic vertebrae, labeled T1 to T12. There's 5 lumbar vertebrae, L1 to L5. And then we get into the sacrum, okay? And you'll see there the sacrum looks fused, and it is. It's one bone, but really used to be 5. And then we have the coccyx there, which is CO1 to CO4, okay? Functions there of the vertebral column, easy enough, encloses and protects the spinal cord, supports the head, muscle attachment for the rib, pelvic girdle, bone attachment, articulations there, okay? How many vertebrae are there in infants and children? 33. In adults, 26. Okay, count them up. 33 in children, 26 in adults. Why? Because the bottom, the sacrum and coccyx fuse. Okay. What are the intervertebral discs? The outer ring is made of fibrocartilage. Okay. Do you remember there going back here to the hyaline? Where was that? The articulating cartilage there was hyaline cartilage. Okay. Now what we have here, fibrocartilage. This is the intervertebral disc. This is for cushioning, different kind of cartilage. Okay. More squishy, more for absorption, okay, more cushiony, all right. C1 and C2, these are very important. Every biology class has got to talk about these ones here. This is because C1, this one here holds the head, okay, the very, very top vertebrae. You can see there it's not very structurally sound. It's not for weight bearing. It's for mobility. You can wag your head all around. You can move it, rotate it, and that's all because of the atlas and the axis. No weight bearing at all here. Atlas is the top vertebrae, top upper surface, articulates with the occipital bone. Okay? The occipital bone right here. That's where that one sits. Okay? This one here is involved in the yes motion. As opposed to C2, which we call the axis, this one here is involved in the no motion, the left-right. Okay? Contains a unique structure called the dens, and it's this tooth-shaped process that projects up so that C1 can sit on it. Okay, good. The thoracic vertebrae, you can see there that these ones here are quite different from the cervical. There's really not much going on for these ones here. They're kind of like little chicken bones, all right? But now you can see here that these ones here are a little bit heavier, a little bit more weight-bearing capable. And you see that these guys here have a vertical, vertebral body, okay, for a little bit of weight-bearing. Not crazy, but some. You'll see there's no vertebral body when you're talking here, these ones. Okay, these ones here are larger and stronger than cervical, but smaller than lumbar. They have facets. You see these little facets on here for rib articulation. Movement of the thoracic region is limited there by the attachment of the ribs to the sternum. So you'll see there that each of these, they articulate there with the ribs, as you can see right here. Okay. And you'll see there, this is the anterior person, this is the posterior where the vertebral column is, and you see how these ribs there, they articulate right in there. Okay. The lumbar vertebrae, there's no articulation there with the ribs because we're too far on down, but you'll see there, look at the size of that vertebral body. That's massive. These guys, their job is holding up the fort. Okay, these guys here, they can take it. They're heavy, load-bearing, that's their job. But unfortunately, a lot of issues can arise from these guys here. Okay, you see the intervertebral disc, there's your cushion. Okay, largest and strongest of the unfused vertebra. Okay, attachment there to the large muscles of the back. And just please remember, bend your knees when you're picking up anything, because these ones here, once you have trouble with them, you have trouble for life. Okay. The vertebral disc there, the outer ring is made of fibrocartilage, interior soft elastic. They provide shock absorption. Nothing too crazy there. The three kinds of cartilage there that I wanted there to show you guys here, basically the function of cartilage: sustains great weight when covering the articulating surface of bone, shock absorbing pads there between the articulating bones of the spine, provides strong yet pliable support structure in the external ear, nose, respiratory passage. Cartilage permits growth in the length of the long bones and is largely responsible for their adult shape and size. Okay, more detail right here. I gotta go and see the kids there for a second, so I'm going to pause this again and we'll start off with video number 3, and that's where we'll finish this. Okay, pause. I'm going to take 5. Thanks, guys.